This is the living room of our new house. These are my cards. And this is my presentation. Good day, ladies and gentlemen. Have you ever wondered what someone who suffers from post-traumatic stress disorder is like? Well, take a good look. My name is Antonio Lyles, and I suffer from PTSD. According to the National Institute of Mental Health 2010, over 7.7 million Americans suffer from this disorder. So chances are you personally know someone who does. With this in mind, we will be discussing who can suffer from, some of the causes of, and most importantly, some of the symptoms and treatments for post-traumatic stress disorder. According to the National Institute of Health 2009, anyone of any age can develop PTSD. However, not only are the people who experience these traumatic events at risk, their friends and family are as well. It is normal to experience fear, anxiety, problems with sleep, nightmares, or even an inability to stop thinking about the event after it happens. These symptoms lessen over time and may disappear entirely. For some, however, these symptoms do not lessen and may even intensify. These are people who have developed PTSD. The National Institute of Mental Health and the National Institute of Health cite several symptoms for PTSD. These can include problems with sleep and nightmares, feelings of guilt or numbness, depression, being easily startled or always on edge, angry outbursts, avoid things that remind the person of the event, the inability to enjoy activities that they used to enjoy, memory loss, and flashbacks. While many of these symptoms are manageable on their own, when several of these symptoms develop all at once, life can become very hard to handle. Many sufferers turn to alcohol or drugs in an effort to self-medicate, but this only causes additional problems. There are two primary methods to treat PTSD: pharmacology and psychotherapy. In a literature review done by Deborah Bastian in 2010, the use of pharmacology can be seen. The use of selective serotonin reuptake inhibitors, or SSRIs, is an effective long-term mood stabilizer. The drawback of SSRIs is that they can take up to 6 weeks to develop a therapeutic blood level. For mild cases of PTSD, such as my own, this is generally not a problem. For severe cases, however, a benzodiazepine, or BZD, may be used in conjunction with the SSRIs in the beginning of treatment. They have the advantage of being fast-acting. They can quickly stabilize the mood of the sufferer while the SSRIs build up in their bloodstream. The major disadvantage of the BZDs, however, is that they are addictive. Both during and after mood stabilization, the sufferer is encouraged to engage in talk therapy with a psychiatrist in order to identify symptoms and possible sources of anxiety that can increase the severity of their symptoms. I do not suffer from all of these symptoms, but the ones I do suffer from are bad enough. I take Prozac for my depression. I have problems enjoying things I used to, like playing baseball or even having sex with my wife. Sometimes I'm so easily startled that my family is afraid to touch me without first verbally alerting me to their presence. Whenever I leave the house, I become so anxious that it's hard to function. For example, whenever I go to a restaurant, I have to sit with my back against the wall. Otherwise, I feel like I'm leaving myself open to threats. Perhaps the worst of all is my anger. I'm always very careful around my family because I'm afraid I may inadvertently hurt one of them. However, with my therapy and medications, many of my symptoms are manageable, but there's always that fear of losing control. Remember, Even though veterans returning from war are the most talked about sufferers of PTSD, anyone of any age who suffers a traumatic event can develop this disorder. Next, by knowing the symptoms of PTSD, we can help our loved ones attain early treatment and speed their recovery. Finally, remember that the treatments of PTSD are varied. It can take time to find the right combinations of treatment options that work for each individual person. But with care and attention, sufferers of PTSD can make a full recovery. I thank you for your time.